Maggie Freese. I'm a genetic counselor specializing in nephrology at the University of Iowa Hospital and Clinics. And what I'm planning to talk to you today is about genetic testing and how to go about ordering genetic testing, considerations and best practices for that, and then help illustrate that by providing a case example in clinical practice. So for this patient, it's KT. It's a 30-year-old Caucasian male, and he has a history of CKD stage 3. And he completed a kidney biopsy, which was suggestive of Alport syndrome. And for this particular patient, he also had a family history of hematuria, and that was present within the patient's mother and his maternal aunts. He's primarily interested in completing genetic testing because of family planning information. He's recently married, planning to start a family soon with his wife, and wants to know what the risk is for his children to have Alport syndrome. But he is very interested in learning about insurance information for genetic testing, wants to know about coverage information and cost. So for this provider, when the patient comes to him, he first asks the question of, should I involve a genetics service? So if you feel confident in your ability to answer all these questions for the patient and provide that genetic testing process, always feel confident in doing so, but know that there are always different resources like genetic counselors and other genetics clinics that are available to help you with this process as well. So first, when you're selecting a test and a laboratory for this patient, you'll have to first ask the question of what are we testing for? So for Alport syndrome, we're looking at a condition that has a couple of different genes that are associated with it. So the collagen 4A5, 4A4, and 4A3 genes, each of them with a different inheritance pattern. So very important to discriminate what type of genetic change is present in order to know family planning options moving forward. So for this case, it would be most appropriate to start with a multi-gene panel because that would be the most cost-efficient plan moving forward, looking at 3 genes at one time compared to a stepwise fashion of testing for one gene, then the next, and then potentially another gene. So this has a higher likelihood of finding a diagnosis when you do multiple genes at the same time. So finding a laboratory that has that type of panel available, and then also look at a laboratory that's able to work with the patient's insurance. So are they in network with this patient's particular plan? If insurance requires any sort of pre-authorization, are they willing to submit that for you? Or is that something that you have to handle? Those sorts of questions. And in this case, also looking at out-of-pocket costs a little bit more specifically. So will the lab provide pre-test estimates to the patient ahead of time? Is that an option to them? Or do they have self-pay options or other discount options potentially to help facilitate genetic testing and making it more financially feasible for the patient themselves? So once you have the particular test that you're ordering, as well as the laboratory selected, you'll next want to complete all the other test order requirements. So once you have a downloaded test requisition form, you'll want to be as detailed as possible with filling out the clinical diagnosis and other indications for testing. And you can even attach a clinical note for this patient as well. Making sure that you have all the other forms in there, including a patient signed consent form, and submit copies of the patient's insurance card front and back. For this patient in particular, they selected not to have a sample drawn in clinic, but preferred to have the sample drawn at home due to COVID pandemic. And so the testing laboratory was able to arrange a mobile phlebotomist going to the patient locally and having that specimen drawn. And so once a specimen was drawn, it was then shipped to the lab with all the testing forms, and testing was initiated. The results from the testing were expected in about 4 weeks, and they were returned first to the provider via fax, and then the provider then discussed those results with the patient via telephone. Once the results were discussed with the patient, he had some more questions about family planning options, what this would mean for his family. And so the provider decided to make a referral to a local genetic counselor to then further explain the genetic testing results and discuss all those family planning options. And so the patient was then referred for genetic counseling and had those questions answered. So this is one example of how genetic testing can be facilitated throughout this process.